Welcome to this week's episode of CSR Digest. CSR Digest is a feedback mechanism instituted by Total E&P to x-ray some of its corporate social responsibility programs and policies to host neighboring and impacted communities. In the wake of the coronavirus pandemic, a lot of countries, a lot of states, a lot of local government, a lot of localities had problems with the issue of the virus. And in realization of the enormous impact of the virus to its host communities, Total Exploration and Production Nigeria Limited sat back and ensured that health programs, health facilities, and health instruments were sent to selected hospitals across Rivers State and OMF 58, including the Nigerian Army. My name is Ndu Ajie.
Here's a public service announcement. A few tips for staying indoors to reduce the further spread of COVID-19. Number 1, make a phone call to friends or family members, check up on them to know how they're doing, how they're coping, and send some words of encouragement. Number 2, you can connect to others virtually via social media, Facebook, Instagram, Twitter. Number 3, you can create and follow a daily routine. Something new, something blue will help you stay away from the bottom. Number 4, eat healthy and engage in exercise. Who knows, it could be a way for you to lose some weight and just stay healthy. Number 5, focus on the reason for social distancing. Number 6, play new games with your family, learn new things, and learn new stuff. Number 7, engage your children with fun and interesting activities. It is a time for bonding for families. Let's try as much as we can to stay away, keep social distance, and hey, be safe. Wash your hands regularly with soap and running water for 20 seconds every 15 minutes, and if that's not possible, always have a hand sanitizer. Remember, your hand sanitizer has to be at least 70% alcohol content. Take care and stay safe.
The state governor said the oil exploration company had previously donated medical equipment to the state government to improve its capacity to do COVID-19 testing of suspected patients. He noted that the company did not stop at that, but has brought other items that will promote personal hygiene culture towards the prevention of COVID-19 among Rivers residents. Gabriel said the gesture is a demonstration of the care the company has for the life of its staff, Rivers residents, and all those who do business in the state. While urging them to sustain the friendship beyond COVID-19 fight, Gabriel also encouraged them to commit to discharging their corporate social responsibility in their host communities.
On behalf of the government, commend Total E&P for supporting Rivers State government as regards this COVID-19 pandemic. You've shown that you care for the lives, not only for those who work with you, but for Rivers people and those who do business in Rivers. And so at the appropriate time, Rivers State government will of course publish donations made by individuals and corporate bodies, those who are friends of Rivers State, who supported Rivers State during the course of this pandemic. Because this is the period you require the support of people and not people who will merely criticize government and everything.
Representing the Deputy Managing Director of Total Exploration and Production Company, the Executive General Manager of Administration of Port Harcourt Office of the company, Godwin Baraka, noted that Governor Wike is a proactive leader who responded to the COVID-19 fight early to contain the spread of coronavirus in the state. He said if other leaders had responded in the same manner, the number of infections across the country will have been lower than it is currently. Adding that the governor also approved movement permits for personnel of the company to attend to their production activities.
He has been very exemplary. We join forces with him because he is wonderful. He actually very proactive. He saw ahead. If every other state in this country did what he has done, we would have had the kind of reduced numbers of cases as we have in Rivers State.
Addressing journalists shortly after the donation, Mr. Bandele said the gesture was born out of Total's desire to meet its corporate social responsibility thrust in the area of health, safety and environment. According to him, COVID-19 is a global pandemic that has crippled many economies, and the need for collective fight against its spread cannot be overemphasized. The executive director lauded Governor Wike's continuous effort at tackling the spread and hoped that with Total's contribution and other agencies' support, the dreaded virus can be contained.
So what we are trying to do is lend small support in the right places. We are here with the Ministry of Health of Rivers State. So our intent is to continue to support our stakeholders, to support the community where we are operating, to ensure that we put things in place to demonstrate that we are here for a long stretch.
At the 6th Division Nigerian Army Port Harcourt, Mr. Bandele praised the professional conduct of the Army in tackling security issues in areas of its operation and said Total EMP Nigeria Limited saw the need to support them. While donating the equipment, the executive director enjoined them to continue in their courageous work and put them to judicious use. Responding, Rivers State Commissioner for Health, Professor Prince Chike, thanked Total Exploration and Production Nigeria Limited for living up to its corporate social responsibility and assured that the equipment will be put to effective use. He said the fight against COVID-19 is a collective one that requires all hands on deck, describing Total's gesture as a clear demonstration of the love it has for its host and neighboring communities.
What Rivers State needs at this moment is for support from all and sundry. What these people have given to us, the Rivers State government, Ministry of Health, the Public Health Unit, we are grateful.
General Officer Commanding 6th Division Nigerian Army, Major General Felix Ogugwo, expressed appreciation to Total EMP Nigeria Limited for the donation and pledged to utilize the equipment in curtailing the spread of the virus in the military.
So I want to assure you, sir, that what you have done today will not only help in fighting the spread of COVID-19, it will also help in ensuring that the Army has the capacity to do even the little interventions that we do to communities around this place as part of our civil military corporations.
High point of the ceremony was official presentation of the equipment by the Deputy Managing Director, Port Harcourt District Total EMP Nigeria Limited, Mr. Guillaume Dulaw, to officials of Ministry of Health, while Executive Director Port Harcourt District presented to Nigerian Army. Items donated include beddings, weekly supply of 1,000 liters of diesel, hand sanitizers, medical gowns, goggles, surgical hood, sprayers, among others. Welcome to the discussion segment of CSR Digest. CSR Digest, like I said earlier, is a feedback mechanism instituted by Total EMP to x-ray some of its corporate social responsibilities to host neighboring and impacted communities. And today with me, I have a professional, a health professional, and one of the frontliners who is fighting the pandemic, the coronavirus pandemic all over the world. And he happens to be a son of the soil from the OML 58 operations area of Total EMP, a medical professional, Dr. Smile. Join me as I welcome Dr. Smile. Now, the tradition is we don't shake hands anymore, but we can welcome Dr. Smile. You're welcome to the program CSR Digest. CSR Digest airs every Friday by 9 p.m. on RSTV. In the wake of the pandemic, the coronavirus pandemic, Total EMP, through its medical department, discovered that it is good, it is timely to send some of these materials to some identified hospitals in Rivers State, mostly the Rema General Hospital, which is under the Rivers State Hospitals Management Board, and the Nigerian Army Medical Corps, even the Rivers State government through the Ministry of Health. These things or these items were donated to them to mitigate the spread of the coronavirus pandemic. How do you look at this?
Right, thank you very much for having me. Thank you for inviting me to this program. Yes, Total EMP, like you said, they've been doing well all this while in terms of corporate social responsibility to its host community. Yes, we saw those items donated to, especially to my own area, which is Rema General Hospital. I watched those, but my problem is that yes, in as much as we love Total for what they are doing for the host community in terms of health and every other thing, I have a concern as regards to the Rema General Hospital because yes, they've donated those items, but if you ask me, did they donate the item to a functional hospital? The answer is no, because you and I know, or maybe you are not in the, you may not be aware, I don't know, that the hospital has been shut down for a long while now because of a kidnap event that took place in that hospital some time ago, where I think a nurse or a staff of the hospital was kidnapped, and government in that time, as a policy, say wherever facility of government where they kidnap somebody, government shut them down. So yes, it is good, it is commendable, but is the hospital functioning?
Yeah, but if you talk about the functionability of the hospital or the workability of the hospital, at least we met some medical personnel there, particularly the resident doctor. I know that he received those items and he expressed his appreciation to Total EMP. And then, as a follow-up, we went to the hospital, looked at some of these facilities. We saw personnel, we saw people, we saw patients being, taken care of. That was about 3 weeks ago. You may not have the knowledge of the recent happenings in that hospital right now, but if you...
No. The recent happening in the hospital is that, I am aware that the community, through the community leadership, made some effort to government in order to see how government can reopen the place in full capacity. But what they've been able to achieve so far is that government said government has not really given approval to the full functioning of the place. But what they did was to contract, some personnel, especially doctors from Ahoda General Hospital, to the area, wherein the doctor is assigned to, alternatively visit the hospital at some hours interval, after which he will retire back to Ahoda. So he's not in full capacity.
Okay,
I watched that clip and I saw the doctor. I know him. He worked with Ahoda General Hospital. Dr. Mosu. I saw him in the clip.
Yeah.
I watched it when he received those items. So he comes either twice or so in a week.
Fine. But you see, whether or not the hospital is functioning in full capacity, there is need for a proactive action that has been made by Total EMP to provide those facilities. Now, assuming today the government of Rivers State now said, fine, let's open the hospital in full capacity, and those equipment are there, and the need for those equipment is not. How do you?
Yes, we like I said earlier on, yes, we commend them, but I think like you said, we should be more proactive to ensure that hospital, functions in full capacity, because
it's no more the headache of Total to open the hospital. It's the headache of the government.
Yes,
and then when you are talking about where kidnap happened and they shut down, remember one of the doctors who is our relation was also kidnapped at Ahoda General Hospital, but after some time they opened the hospital. It's in full capacity now. Is that not?
Okay. Yes. So it should not be something that my people should be made to suffer because one personnel was kidnapped. Like you are giving reference, there are other hospitals, that or government institutions where kidnapping has taken place during the wake of those kidnapping. But in my own opinion, I don't think it is reasonable for government to say they will not open the hospital anymore. It doesn't make sense to me. Yes, some lessons have been learned by community members, youth and all that, knowing that yes, they are the ones suffering directly as a result of their activity. But government as a father should have a rethink to open that place because this is a region that has for over more than 200,000 persons, and these people, they don't have any access to medical care. So closing that place down indefinitely, to me, it doesn't really make sense, because there are other areas where this incident has happened, and like you have rightly pointed out in Ahoda, it happens. But the hospital, was not shut down completely. The hospital is functioning now. So I feel that for an area that has sustained this country and this state for over 50 years of oil production, I think government owes them that duty, to provide some of these facilities, especially healthcare. It is very, very bad. Total is doing well, yes, in terms of corporate social responsibility. But when you say it is no longer their headache, well, to some extent it is. Yes, it is also. It should be the part of their responsibility to also see that areas where they are working, there is also a peaceful environment.
Okay, fine. Now, what happened to Obagi General Hospital? I mean, Obagi Cottage Hospital. You are a professional.
Yes.
Now, if you go to that facility now, you will be disappointed at what is there. What is going on there? Can you speak like a professional there?
Yes, what is going on there is a government policy. When that place was built that place was built by Total with the view that it's going to serve like a secondary health care. At the end of the completion of that cottage hospital, the stakeholders from that area, alongside with Total, approach government to see how government can take over the place as a secondary health care, to cater for the need of the people. But government in its policy say no, they cannot have, because at that time you already have Omog General Hospital. You also have the Rema General Hospital, and government said no. A local government cannot have more than one general hospital. So it was as if we were even lucky to have two already, and we're not asking for the third one. So, so that was why government now said no, they cannot have three general hospitals in an LGA. So the place was now dropped down to a primary health care.
Okay, fine. Now, when you're talking about the primary health care, we also have one in Obogu, if you can remember. At least I have joined Total to distribute drugs, free drugs, to even free medical free medical activity had happened in Obogu. What is the state of Obogu Primary Healthcare Center?
The state of Obogu Primary, see, that's why I told you that the people of the area, the people that have sustained the economy of this country for over 50 years, yet you cannot have a good health care for the people. The Obogu Primary Health Care, yes, is there, but the Obogu Primary Health Care, most of the primary health care facilities across that area, across clan, they don't have doctors. So what do you make of a health facility without a doctor? So, okay. So if you go to...
Is it the responsibility of Total to post doctors there?
No, it is not the responsibility of Total to post doctor. It is the primary responsibility of government to post doctor. Government owes as a duty to these people that have sustained, the economy of the state and the country at large. At least, health care, a good and quality accessible health care. But yes, it is not the primary responsibility of Total, but I think in a way they can also they can do something. They can liaise with government to see that the environment where they are working, if not for anything, health is wealth. So it should be considered as a priority. It should be considered as a priority, and that is why we as doctors from that area, we are also asking for alternative health care, such as a health insurance scheme, the likes of OBO, and the Bonnet health care scheme. So we are saying that that is the way to go. By so doing, is a multi-stakeholders engagement, where Total will be involved, government will be involved, the people will be involved, so that we will be at the end of the day. By so doing, if we have such system, in Rivers State today, if you look at government facilities where you have the bulk of patients, If you remove, if you can't, University of Port Harcourt Teaching Hospital, River State University Teaching Hospital, the next place will be Obio in terms of population, in terms of access, and patronage. So we are saying that that is the area, the doctors from that area, we have advocated that yes, that is the area, that is the way to
have
go.
Have you made a written proposal to that effect?
Yes, we are still working. We are still working to that effect. But I think we have made some stakeholder consultation, and they are of the opinion that yes, it is a good way to go.
All right. Away from that, talking about coronavirus, Total EMP on their own, they were proactive to be able to send some materials to health materials to selected hospital, including the Nigerian Army Hospital here in Borikam, the 6th Division of the Nigerian Army. Do you look at that?
Yes, I think in the wake of the pandemic, we saw all that. We saw Total EMP. Total, in terms of social corporate responsibility, is one company that you can tick high, among the multinational oil company. I think they were one of the corporate organizations that come to the rescue of the River State government, by providing, before now, we were not testing because we didn't have a testing center. But when Total came in, they were able to provide, the testing machine. That was when River State government, start testing for the pandemic. And I think to me, it's encouraging. They didn't do that only to the River State government, like you rightly said. They also did that to a federal institution, which is the military hospital. So Total in its corporate social responsibility have done well in that direction. But like in River State, like I've always said, I think we should move away from everything at the center, everything at the state capital. Health is not only the people in the state capital that have capital that has a health issue. The bulk of the health problem we're having are in the rural areas, rural communities. So government should, while Total is also doing their bit by providing some of this equipment, government should also assist, so that at the end of the day, this equipment cannot use themselves. They need manpower, they need personnel. So, and it is the sole responsibility of government to engage personnel into these various health facilities for optimal use of this provision by Total.
Now, in all of this, how do you look at the health policy of Total EMP?
Well, the health policy of Total EMP, especially, I want to narrow it down to the UME 58 area.
Yes.
Yes. As a medical professional or practitioner, I have participated in some of their programs, especially the annual free health program that is organized every year. They have organized it at the Rema General Hospital. In the wake of the crisis, they moved to Auda General Hospital. I have also attended some of their health awareness campaigns, such as the Robot Malaria campaign. I am also aware that they have also done some training in terms of giving some knowledge and skill to traditional birth attendants in order to reduce child and maternal mortality, in the area. But like I've said before, yes, while we commend this initiative or these activities of Total, but I think it is not enough, in my own opinion. It is not enough. So that is why we are saying that the way to go is that, because if you look at some of those programs are not sustaining. For instance, the UME 58 annual mass free health program, it's something that is done once in a year. And being a place that don't have an active or functional health system, it means that annually, after that 1 week period of that program, you are on your own in terms of health care. If you have any problem, it means that you have to wait again the next year for Total to bring a free health program before you can, take your complaint. So that is why we are saying that it will be nice if we have a focused health program, such as the again health insurance scheme, so that we have an active functional health facility that will be affordable, to be cheaper, to be accessible for the people, so that we don't wait annually for a free mass program. You see, like I told you before, it is area that is in excess of 200,000 persons, and there is no a functional health facility. It is very bad. And if you look at the free health program that they do, I have been directly involved. I can tell you that health program takes care of less than 5% of the population of that area, and it is only about 0.4% of
5% of the population of the sick, because it's not everybody that should.
Yes, it's not about, you can't say 5% of the people that are sick, because if you give access to healthcare, because if you say 5% of the people that are sick, then it means that 5% of the people that are sick wouldn't be it, because you have to take cognizance of the population of the area. Okay. You cannot take you don't take health indices with respect to the people that are sick. You take them with respect to the population of the people. Right. So it is very poor to see that an area that is in excess of 200,000 have provided. And when we talk about these 200,000, remember we're just talking about the OMF 58. Yes, again form the bulk of the OMF 58, but there are other community that this free annual health program is done for. You have Ahoda, you have Elilo Canale, you have Elilo Alimini, you have Ulu and all that. You have, So, but the projection I'm giving you is just within the bulk of the larger population of which is the OMF 58. So if you take the total population of the people under OMF 58, it is more than what we are saying. So we are saying that the way to go, we should have a free health insurance scheme for the people. I have gone to OBU to ask questions about the running of that place, and if we have such thing replicated in again, I think it will be good for the people.
But on this note, we have to thank you for coming on this program. We hope that next time when we call upon you, you will assist us to come and shed more light on health issues of CSR Digest. Thank you so much for coming.
Thank you for having me.
That brings us to the end of this week's episode of CSR Digest. CSR Digest will come your way again next week, God willing. Thank you so much.